Hello, everybody, and welcome back to the podcast. I'm your host, Dr. Zhanna, and today I'm going to teach you my secret method on how you can stop running behind because of chatty patients. Do you have patients that have a lot of questions and they kind of like to chat? Maybe it's during the consults, or maybe it's just your regular patients in the Bay, and there's just some patients that have a lot of questions. And you try to be nice and you want to answer their questions and you want to make sure they're engaged in the treatment, but your blood pressure is just rising when you watch that tracker and you see how many other patients are waiting for you while this beautiful, amazing, wonderful patient in front of you just won't stop asking questions. So if that's you, this episode is perfect for you. I have found a way when I literally nailed it. I've never had a situation where I had an upset patient over telling them what I'm about to tell you on this episode. It's going to be a quick episode because it's literally a miracle phrase that you can use that helps you stop the chatty patients from asking you questions and helps you get out of the appointment without them being offended or you feeling guilty or like you're not giving the best quality of service. And you may want to share this with your team, with your assistants, or maybe with your salespeople, your treatment coordinator, your front desk, whoever is dealing with those chatty patients. And sometimes we know who they are, aren't we? Sometimes we look at the schedule like, oh, Mrs. K is coming. It's gonna be a good one. Let's put her in the VIP room. Let's give her a longer appointment, right? I'm not saying to eliminate those precautions, but the phrase, I'm going to teach you a couple of sentences that you can tell a chatty patient. I challenge you to try it this week. It's going to be a game changer. All right, you guys are ready? So let's picture a situation. Maybe you are in, let's just say it's a regular patient. So a regular appointment, you're talking to them about something and you're trying to wrap up your recommendation, what are you going to do next time, and things like that. And they just keep asking you questions. And you're probably on answering their fourth question. And the appointment, you look at the clock and the appointment is like literally ended already. So you really have to go. And she just keeps going, or he. But in my experience, it's usually a she. So here's what you want to do. She asks you another question, and you're going to say, Zhanna, this is a fantastic question. Thank you so much for asking. Here's what I want to make sure I do. I want to make sure we have enough time for me to properly answer your questions without rushing. So what we're going to do is we're going to schedule your follow-up appointment so that we can have an uninterrupted time for us to discuss this. How does that sound? I'm going to have Mary schedule you right now. That's what I want you to do. Okay, so let's practice it again. What you're going to say is once she finishes asking that question, you're going to say, listen, this is an amazing question. So you're going to acknowledge that try to be as energetic and authentic as you can and practice saying this a couple of times, okay? Because the first time it's not going to come natural. It's going to come a little clunky. It's going to come a little like maybe weird or forced. It's totally normal. It's the first, you're learning a new skill. Obviously, you're not supposed to be excellent at it. I teach my clients how to close consults at 90 to 100%. And I have a method inside of the Conversion Queen on how to do it. And it takes them a minute. Even my private clients, like we have to role play sometimes, even the simplest things, right? Because you have your way of how you're used to talking to people. So give yourself grace. My advice is re-listen to this podcast a couple of times, and I'm going to break it down with you right now here on the podcast again. But really give it a shot and practice. Practice at least 3-4 times, just talking to yourself in the car, whatever you're doing in the shower, before you actually tell it to the patient. And really like pretend like you're like this is a real conversation. You're really talking to a person. Okay, you ready? So she asks you another question. You're going to first acknowledge her question and what a great question it is, right? Thank you so much, Zhanna, for asking me this question. It's so important for me that I make sure I fully answer that question for you, right? Now you're showing that you really care and you want to make sure that you address this question properly. And you can say sometimes, I'm changing a little bit, there's another modification for you, right? You can say, unfortunately, we're out of time today, but I want to make sure that we have uninterrupted, proper amount of time for me to answer all of your questions. This is very important to me. So what we're going to do, notice how you're not giving her an option. Would you like to reschedule? No, she doesn't. She wouldn't like to reschedule. She's here. She doesn't want to drive again. So we're not going to use that language. We're going to use the decisive language that the decision has been made. This is what we're doing. You're just stating the facts. Okay? So what we're going to do is we are going to schedule a follow-up appointment for you. If it was a consult, you're going to say, we're going to schedule a follow-up consultation for you, where I can make sure that I answer all of your questions with plenty of time, or I answer all of your questions without interruptions. Sounds good? Get a buy-in. Make her feel like she has a say in it, like she has a choice. She'll say, sounds good. And then you just, whoever is your team member, or if this is the conversation that your team member is having, they just pull up the calendar and say, how does that week sound for you? How does this day, when are you available this day of the week? And then you reschedule that. That's what you do. That's what you do, my friend. And if it's, let's say it was a consult and you are crazy busy, and let's say you're booked out for the next month or two, then you schedule a phone call with this person. Okay? And if on that phone call or on that second appointment, they go over time again, you do the exact same thing. Okay, my friend? You are welcome. This has never failed me once. I have never had an upset patient, and none of my clients have ever reported having a pissed off patient after they use this phrase. So remember, you want to practice this a couple of times before you talk to the patient. We're listening to this podcast episode, bookmark it, save it. And as always, with this podcast episode comes the worksheet, so you can print it out and you have it available until you're developing this muscle of how to talk to chatty patients so that they don't capitalize all of your time and destroy your schedule, so you're always running behind. All right, my friends, enjoy. Let me know how it goes. Bye.